The patient should be positioned as appropriate for a posterior approach, taking care to preserve or improve sagittal alignment of the spine. Using a combination of surgical instruments appropriately selected by the surgeon, a laminotomy, laminectomy, and/or facetectomy is performed, along with the removal of the ligamentum flavum, to gain access to the disc space and identify neural and bony anatomy. After the pedicle pathway has been prepared, appropriately sized screws are inserted into the pedicle, followed by the introduction of the rod using the rod pusher. Rod reduction may be achieved using the dragonfly. The dragonfly, as well as the quick locker, may be used to partially lock the screw head on the rod on the contralateral side. A K2M distractor may be used for initial distraction to access the disc. Using any combination of nerve retractors, the cauda equina and nerve are mobilized to expose the annulus of the disc. Using a scalpel, an incision is made to the annulus of the disc, and the discectomy is performed as needed using appropriate surgical instruments. With the mesa screw in the partial lock position, the spine can be distracted using the disc spreader with no additional instrumentation required. The proximal end of the disc spreader slides into the distal tip of the long T-handle. Distraction is sequentially performed by the surgeon until the appropriately sized spreader is selected. Disc scrapers are available for gross removal of the cartilaginous end plate. As with the disc spreaders, the proximal end of the scraper slides into the distal tip of the fixed T-handle. Disc scrapers may be used to help repair and decorticate the vertebral end plates. The system incorporates specialized spinal instruments, including curettes in cup, rake, and ring shape. The connector shaft screws into the proximal end of the modular handle, engaging the curette, which fits into the distal end of the handle. These curettes aid in the removal of bony and cartilaginous end plate tissue. Morselized bone graft may be placed in the anterior portion of the vertebral body. Implant trials aid in initial testing, placement, and size confirmation of the implant. The implant size is chosen based on spatial height. The surgeon or staff may utilize the bone packing mold to aid in placement of the appropriate bone graft or osteobiologic. The packing tamp may be used as final prep of the bone graft material in the implant. The implant is loaded onto the adjustable inserter by turning the thumb wheel in a clockwise direction. Rotating the metallic shaft of the adjustable inserter changes the angulations from -10 degrees to 35 degrees. For initial linear introduction, the implant is introduced at a -10 degree angle. The angle is sequentially adjusted until the desired angle is achieved to appropriately position the implant in the space. Additional bone graft may be placed in the posterior disc space if desired. Once implant placement is confirmed, bilateral compression is achieved using the compressor in the mesa spinal system. With the mesa screws partially locked, the compressor is removed. The quick locker, utilizing zero torque technology, is used to finally lock the screws without applying torsional stress to the spine. The Elution Spacer System from K2M, surgeon-driven design.